Good morning.
Good morning.
My name is Hildegard Peplau, and I will be the nurse in charge for care for today. May I check your ID band, please? Can you state me your name?
Mrs. V.
Okay, Mrs. V, how are you feeling today?
Well, I'm not really feeling good today. I think that my pain in my left breast is worsening as time goes by, and I also feel a lump on this side. I've been feeling this for quite some weeks now, but I've been very busy, so I wasn't able to have my checkup with my doctor right away.
Now the nurse and patient are strangers to each other, so the nurse approaches the patient with respect and positive interest.
Oh, yes, Dr. X already read the result of your breast ultrasound, and he suggested that you will undergo breast tissue biopsy.
Oh, do I really need that breast tissue, whatever?
Oh, yes, as explained to you by Dr. X, with regards to your condition, you will need to undergo breast tissue biopsy because
As a resource person, the nurse answers questions based on patient's level of functioning and psychological readiness.
so after knowing the result of the biopsy, how do you feel about it?
I don't really feel good about the result. Dr. X explained to me the treatment options, but I don't think that it will help in my career as an actress. I think it will greatly affect it because I have two upcoming movies where I will be the main star, and I don't think I will be fit for that role after this.
Okay, Mrs. V, I can hear your concerns about your acting career after the surgery, but I believe you still can pursue acting after that. You just have to undergo some procedures, and then you'll have to have careful healthcare management, which we will be discussing for today. Are there any specific concerns that you would like us to start from?
Yeah. I have some more concerns.
As a counselor, the nurse observes and listens to patient in a way that helps patient fully understanding of themselves, their feelings, and their actions.
Okay, thank you for opening my mind about all those things.
During orientation phase, the nurse helps the patient to understand and recognize her needs. Days, Mrs. V was diagnosed with second stage breast cancer. She wasn't sleeping well. She was not even eating well. She was depressed. Her mood, behavior, everything changed. These symptoms prompt her to see the doctor again.
Hello, Mrs. V. It's Hildegard once again. How are you feeling today?
I'm really feeling anxious about my surgery.
Actually, most patients who undergo surgery feel anxious before it, especially that they do not know what to expect from it. What I can recommend for you is to do some relaxation techniques, such as deep breathing exercises. I, keep, I came here today to remind you about refraining from drinking or eating anything 8 hours prior to your surgery.
Okay. Okay, I will do everything that you told me.
Okay, here's the call bell. If you feel anything unusual, just press it so I could come here shortly.
Surely. Thank you.
As a leader, the nurse encourages the patient to be active participants in planning their care.
This is identification phase. In this, the nurse identifies who can help. The nurse permits exploration of patient's feeling, and she strengthens the feelings and personality and provides needed satisfaction.
Now that we have established everything with regards to your surgery, we will talk about your concern on breastfeeding your future children after mastectomy.
Yeah, I'm concerned whether I'll be able to breastfeed my future children, and will there be any effect on their health?
Oh, Mrs. V, the good news is there will be no effect to your babies because you still can breastfeed using your other breast.
Okay.
So what we will talk about now is your another goal, which is equally important, which is the do's and don'ts after your surgery.
Okay.
So before surgery, you will do.
As a teacher, the nurse considered what patients already know and their level of interest to develop learning situation that enable patients to learn.
This is exploitation phase. In this, the nurse identify new goals which can be achieved by personal effort. And it is important to note that the power shift from nurse to patient so that the patient can achieve the new set goals.
Thank you for all the teachings that you've shared to me. You remind me of my sister.
Oh, I'm glad that you understand the benefits of mastectomy as well as the do's and don'ts after the surgery. Now I could say that when you go home, you will be more confident and independent to do your own care. But I noticed that you keep mentioning about my similarities with your sister. But
In a surrogate role, the nurse recognizes similarities and differences between nurses and the recalled person.
This is the last phase and named as resolution phase. In this, there will be a termination of nurse-client relationship. The nurse will adapt to the new goals and will set aside the old goals.
Peplau! Thank you! Bye!